Move it on, huh? Hello, everyone. I am Dr. Muzamil Liaqat Ali, Assistant Professor of Biochemistry. Welcome to this important lecture on androgens, the male sex hormones, primarily testosterone and its more potent metabolite, that is dihydrotestosterone. In the previous lecture, we studied the gonadotropin hormones. Today, we complete the picture of gonadal steroids. Androgens are not only responsible for male sexual differentiation, spermatogenesis, and secondary sexual characters, but they also exert powerful anabolic effects on muscle, bone, and metabolism. Understanding this or their biosynthesis, mechanism of action, physiological function, biochemical function, its regulation, and clinical disorders is very essential for gynecology, endocrinology, urology, and even for the forensic medicine. So let's proceed with biochemical precision and strong clinical correlation. Our learning objectives are clear and clinically focused. So, what are these learning objectives? Describe the biosynthesis and transport of the male sex hormone, the androgens. Those are the testosterone and dihydrotestosterone, the DHT. So, by the end of this lecture, you will be able to outline the biosynthetic pathways of testosterone from the cholesterol molecule, explain transport, the activation of the DHT, and the mechanism of action. Detail the physiological roles of the androgens from the fetal life to adult life. Discuss the regulation, therapeutic uses, hypogonadism, and the dangers of the anabolic steroid abuse. So these concepts frequently appear in the university exams or in the clinical exams, right? So involving infertility, impotence, osteoporosis, and aggressive behavior. So these are the learning objectives, learning resources for the deeper study, right? So these will help you reinforce the pathways and clinical correlations we cover today. Testosterone is a principal androgen. It is an anabolic hormone secreted by the Leydig cells of the testes under the influence of LH. In blood, around 95% is bounded to proteins, male sex hormone binding globulin, that is SHBG, and albumin, and 5% circulates freely and is a biologically active form. So, testosterone is rapidly removed from the blood. So, the half life is around 30 to 60 minutes by uptake into the target tissues or the metabolic inactivation. In target tissue, it is converted to the more potent DHT form. In adipose tissue, aromatase converts it to estrogen. Approximately 0.4 mg of the testosterone is reduced to DHT daily in testes and extratesticular tissues. So, increased aromatase activity in the obese men raise estrogen levels, contributing to the gynecomastia and reduced testosterone effects. So, androgens are synthesized in the testes and adrenal cortex, ovary, and the placenta from the acetate via the cholesterol molecule. So, key steps involved are the very first one is the cholesterol undergoes side chain cleavage to form pregnenolone. Number two, in the endoplasmic reticulum, 17 alpha hydroxylase or 1720 lyase removes 2 carbon to yield 19 carbon steroids. Step number three, that is 3 beta hydroxysteroid dehydrogenase oxidizes the 3 beta hydroxyl group to produce the androstenedione. And the final step, that is the fourth step, that is the rate limiting step. 17 beta hydroxysteroid dehydrogenase reduces this 17 carbon keto group of the androstenedione to yield testosterone. Testosterone exerts effects either directly or after conversion. So, pregnenolone can enter two parallel pathways. That is delta 4 pathway that proceeds via the progesterone to produce androstenedione and finally the testosterone. While the second pathway, that is the delta 5 pathway, terminates at the dihydroepiandrosterone formation. The relative activity of competing enzyme determines which pathway predominates in different tissues. So, testosterone exerts effects either directly or after conversion. In most target tissues, binds androgen receptor directly. In prostate, skin, and external genitalia, converted to DHT by 5-alpha reductase. That is much more potent form of the testosterone. In adipose tissue and brain, that is converted to estrogen by aromatase activity. So let's talk about the mechanism of action. 95% bound to plasma protein, and the 5% is free form. So free testosterone enters target cells, binds systolic androgen receptor, and finally the DHT binds to the same receptor with 5 times greater affinity. And the hormone receptor complex translocate to the nucleus, binds hormone receptor element on the DNA and regulates gene transcription. So that promotes the protein synthesis. This classic steroid hormone mechanism explains both rapid and delayed androgen effects. So, what are the important functions of androgens? Androgens act throughout the life and intrauterine life, secreted by the fetal Leydig cells from the genital ridge, essential for differentiation of male internal and external genitalia, the penis, scrotum, the seminal vesicles, prostate, and vas deferens. And it also suppress the female genital structures, promotes the testicular descent from the scrotum from the second month of the gestation. So let's talk about early infancy. Brief surge in first weeks of life support brain development, that is organizational effect on sexual behavior. Now let's move to the puberty and adolescence. That is the development of the secondary sexual characters, growth of the facial, axillary, pubic, and body hair. So enlargement of the testes, scrotum, penis, and the prostate. It also affects on the deepening of the voice. That is the hallmark feature that done by the laryngeal hypertrophy. So male body habitus, that is broad shoulders, narrow pelvis, and increased muscle mass, along with appearance of the Adam's apple and male pattern sexual behavior. In adults, spermatogenesis acts on the Sertoli cell with FSH. It maintains the libido and erectile function. So let's talk about the anabolic effects in adulthood. That increases the muscle mass, bone mineralization before the epiphyseal closure, and basal metabolic rate. That stimulates the erythropoiesis. This is what explains higher hemoglobin in males. It increases glycogenolysis and glucose uptake. That is selective renotropic effect. It increases the fructose production in seminal vesicles. So now let's talk about the control and regulation. Testosterone secretion is stimulated by the LH from the anterior pituitary. LH is stimulated by the GnRH, gonadotropin releasing hormone from the hypothalamus in a pulsatile manner, right? So negative feedback testosterone and DHT inhibit the gonadotropin releasing hormone and LH secretion. So, what about the additional factors? Weight loss, zinc deficiency, aging, sleep, and anti-androgens like finasteride modulate the secretion of the testosterone. So, what about the approved therapeutic indications and symptoms of the hypogonadism? Hypogonadism is diagnosed when serum testosterone is less than 300 nanogram per deciliter plus symptoms. So, primary hypogonadism, that is the testicular failure, and the secondary hypogonadism, that is the effect lies in the pituitary and the hypothalamic disease, or the patient is having hypothalamic disease. So, common symptoms are the anemia, loss of muscle mass, reduced bone density, abdominal obesity, erectile dysfunction, reduced libido, infertility, fatigue, depression, hot flashes, and testicular atrophy. So, what about the treatment options for the hypogonadism? Various testosterone replacement preparations are available. So, they may be intramuscular, subcutaneous pellets or the injections, intranasal gels, oral capsules, or the topical gel and the patches. So choice depends on the patient preference, compliance, and needs to avoid the supraphysiological peaks, right? So now let's talk about the anabolic steroid abuse and its side effects. Anabolic androgenic steroids are synthetic derivatives abused for muscle building. Side effects include cardiovascular, maybe the hypertension, cardiomyopathy, and atherosclerosis. In liver, the pileosis, hepatis, and the tremors. Endocrine side effects include, or the side effects include in endocrinology are the testicular atrophy, infertility, and gynecomastia. Psychiatric are the aggression, the roid rage, right? The depression, the psychosis. Dermatological are the acne and the baldness. Increased risk of prostate cancer and the sudden death may occur. And severe are the high steroid abuse. As you can see on your screen, this illustration shows the side effects of the abuse of the testosterone. So here we go with the clinical case. A 32 years old security guard and a bodybuilder presented after killing his girlfriend. He had a history of daily weight training and long-term anabolic steroid use. The list of the steroid are the testosterone enanthate and metendione and the trembolone, right? So blood and hair analysis confirmed chronic abuse. The homicide was attributed to steroid-induced impulsivity and aggression in the context of an antisocial lifestyle. So, so here we go with the questions related to the case, right? So, what is the relationship between the misuse of the anabolic steroids and body or muscle dysmorphic disorders? The second question you need to solve that is the what plasma androgen levels are typically achieved by abusers. And the question number three, what effects do anabolic steroids have on the brain and other organ systems? So we have now comprehensively covered the biosynthesis transport mechanism action, biochemical and physiological functions, regulation, therapeutic uses, and clinical disorders of androgens, including the serious consequences of the anabolic steroid abuse. In the next lecture, we will integrate, we will discuss the female sex hormones and discuss the hypothalamic pituitary gonadal axis in great detail. Thank you very much for your attention. If this lecture clarified the biochemistry and clinical importance of androgen, please like the video, share it with your batchmates, subscribe to the channel for more and complete high-yield medical biochemistry series. Turn on the notification bell as well. So drop your questions and doubts, thoughts about the clinical cases in the comments. I read and respond to every single comment personally, which aspect, either the biosynthesis, functions, or anabolic steroid abuse. Would you like me to explain further? This is Dr. Muzamil Liaqat Ali signing off. Revise the biochemistry or the biosynthetic pathways, mechanism, action, and functions related to the testosterone daily. So they are of very high yield for exams and clinical practice. So stay focused, stay ethical, and keep mastering medical biochemistry with precision and passion. See you in the next lecture. Thank you very much.